Dr. Oz, over here. As we spoke about when you visited, I want to talk about some Rhode Island issues, because Rhode Island has a very fundamental issue, which is that between 2018 and 2023, which is the most recent years for which we have data, Rhode Island hospitals were paid less than nearby Massachusetts and Connecticut hospitals by a margin of over 20%. The margin of underpayment for Rhode Island hospitals compared to hospitals across the border ranged from between 20% and 28%. As a doctor, I think you pretty well understand that if you've got two hospital facilities that are less than an hour apart from each other and that are in the same regional healthcare market, and one is paid 26% less than the other, you have created a massive and harmful distortion. Rhode Island has been on the losing end of that distortion for years, and I am sick of it. So I'm flagging that for you right now. One of the potential ways out is the AHEAD program, because a fee-for-service billing is going to screw Rhode Island, and we can't fix that. The way to do that is to get out of fee-for-service and to a value-based program. We just heard that the AHEAD program is going to continue forward. I'm delighted about that. You and I are going to be in touch about making sure that Rhode Island's AHEAD program competes fairly with Connecticut's AHEAD program, because they work off a cost basis. And our cost basis has been suppressed by 20 to 28% lower payments. You can't pay your nurses, you can't pay your cleaning crews, you can't pay your phlebotomists the same amount when your revenues are 26, 28% below your competition. And let me just add to this by pointing out, you know this area, right? You practiced in Boston.
I went to school in Boston, but I practiced in New York.
Okay. So from going to school in Boston, you probably know that Rhode Island's hospital complex in Providence includes Rhode Island Hospital, which is the only level 1 trauma center in southeastern New England, the only level 1 pediatric trauma center in southeastern New England, the only verified burn center in Rhode Island, an academic medical center, a teaching hospital, has a pulmonary hypertension center, and obstetrics and a NICU are at women and infants. It is a node of connected buildings that provides extremely high-level care. If a president is in Martha's Vineyard and gets hurt, Rhode Island Hospital Trauma Center is where they're taken. They fly right over St. Anne's Hospital in Fall River to get to our hospital in Rhode Island because we made the investment in level 1 trauma care. St. Anne's Hospital that they flew over would be paid 20+% more for the same services while delivering none of those options. So I'm going to be on you like a ferret to get this fixed. It is totally unfair. Bacchus Hospital is probably a 25-minute drive into Connecticut from Westerly Hospital in Rhode Island. It's probably a 25-minute ride from our trio of world-class hospitals, Rhode Island, Hasbro Pediatric and Women and Infants, to St. Anne's Hospital, just out 195. And for the same service, we get paid 20 to 28% less than in those hospitals. I am so sick of CMS right now, it just makes me infuriated. For years, CMS has sat idly by, looked at that payment differential and said, oh, what a pity, too bad, we're not going to do anything about it. And we tried to fix it through the AHEAD program. Oh, well, maybe, but I don't think so. So we really need to get this fixed. It is wrong, and it is really dislocating healthcare in Rhode Island. We have doctors moving over the border to take advantage of better payments. We have a fight for staff when we have to compete with other hospitals within the same commuting range that get better payments. So I have 10 seconds left. I'll leave it at that. You heard a lot from me when you came to sit with me. You heard a lot from me today. I'm going nowhere on this. In the years I've been fighting it, not once has any person at CMS ever been able to provide any excuse or any justification for it. None. They don't even try to justify it. They just don't give a red hot damn about this incredible unfairness that is dislocating and warping our healthcare system. So if you'd like to respond briefly, please do. I suspect I'll hear you look forward to working with me on it.
Well, I did a little homework after the office visit, the thrashing that I experienced.
Thrashing CMS, not you. You're not responsible for this yet.
Yet. It does seem to require a statutory solution. However, the AHEAD program is a promising potential opportunity. I don't know enough about how the reimbursement would be altered, but I did want to point out that I went back and looked at the numbers that you shared with me. And it's interesting that how they were calculated. Again, it was driven by a congressional formula, but Senator Sanders, for example, he's paid 25% less than you. So if you think Rhode Island has it bad, Vermont's really that way below the average. So I think there are opportunities to revisit that. I think that's probably something with your passion will probably be revisited by this chamber.
Thank you.
Well, you and I will be talking about it. Thank you very much, Mr. Chairman.